In part 2 of our look at 3D printing, we take a look at the uses in the medical field. Baystate Medical Center in Springfield is using 3D printed models which are produced in-house to help doctors with pre-surgical planning and education, providing better outcomes for patients right here in Western Massachusetts, they say. Carolee McGrath brings us the story.
Greg Gagnon is a biomedical engineer and service specialist at the Clinical Engineering Department at Baystate Medical Center in Springfield. When he started his job, his focus was largely on fixing critical medical equipment needed for patients. But in the last few years, with the advance of 3D printing, his focus has shifted.
Basically what happened is I was looking for a solution to a problem, and the problem was that we couldn't buy certain small parts without buying an entire assembly. And also some of the parts that we were buying were very simple plastic pieces that were extremely expensive. So I was just trying to find a way to pretty much lower costs of fixing some of these parts.
With a $3,000 investment in a 3D printer, Greg found a cost-saving solution.
Once some of our surgeons had found out that we can actually take a CT scan and an MRI and segment out parts of your anatomy and then be able to physically print it out, they were pretty excited.
At any given time of the day, you will hear the hum of the 3D printer in Greg's office, printing out models which doctors can use for pre-surgical planning and for education. The printer takes the information from an MRI or a CAT scan and makes the image three-dimensional.
To go from looking at something like this to obviously an actual 3D image helps patients understand their condition better. 3D printing is really additive manufacturing, which very simply means starting with nothing and then building up layer by layer to make an object.
This is a 3D printed model. This structure here is the heart. This is a cystic tumor that was adjacent to the heart that we had to remove.
Dr. Kevin Moriarty is the Surgeon-in-Chief of Children's Hospital and Chief of Pediatric Surgery at Baystate.
So when we look at a plain X-ray or a CAT scan or an MRI, it only gives you so much information. So when we work with our engineers to create this, Greg created this 3D model from the CT scans working with our pediatric radiologist. It gives you prospectively a better idea, like this tongue of tissue that was coming up. We couldn't see that anatomically at the time of surgery, but we knew it was there. And it made the operation, I think, definitely go smoother and faster.
Dr. Moriarty says the 3D model also helps patients understand the procedure.
We use it for family education so they can get a better conceptual idea of what we're doing. Because they're not radiologists, they're not usually medical professionals. So when you look at this, it's like, yeah, I can see this.
Other applications of 3D printing in the medical field include producing prosthetic limbs. Researchers are even working on using 3D printing to produce replacement organs. The uses for the technology are helping doctors explain and improve care for patients.
3D printing has been used in the area, but it's been outsourced. When people need things, they would send off requests and have something printed. But it's much easier when it's in-house. So as soon as it became available in-house, then I began using it for something that it hasn't been used before, which is patient education.
Dr. Michael Yunus is the Chief of Radiation Oncology at Baystate Medical Center. He has used 3D printing for patient education, and in a recent case, he used it to help administer pain medication to a woman with a benign tumor on her neck.
This is a patient that had a C7 schwannoma that had previously been operated on, so you can see there's bone missing from the vertebrae. The spinal cord runs right down the middle. And there's really no way, based on the imaging, to know exactly how to get where we wanted to get. So I worked with anesthesia and I worked with our 3D printing to sort of figure out what is the actual anatomy, and we could come up with a plan for attack for how to reach the spot. And without that 3D printing, it would have been almost impossible.
This new technology also cuts down time in surgery, which provides a better outcome for patients and reduces medical costs.
If we do it with less time, It's less of an anesthetic for the patient. It's less costly because the OR costs money. It can be depending on the OR, $50 to $100 per minute in the operating room, depending on what staff you have and all the equipment that you're tying up. If you can shave time off the operation, the patient's not asleep for as long, and theoretically that's better for them as well.